and I want to be sensitive to time. And so these two panels have kind of collapsed into one. So if we could just pass the microphone back again and go down and go through the second topic. And if anybody wants, Dr. Fellis wants to make a comment, please. Just to mention, the second is research priorities in frenulum surgery. So we may want to skip through. You want to make, okay.
It's just a comment. It's just a comment about myofunctional therapy, and I think we will have two great difficulties to be accepted. The first, one French comic says, the most difficult when you are right is to prove you are not wrong. And another is Sir Edward Skenes, and he says, it's much more comfortable to fail like the others than to success alone. And so it will be very difficult to prove, there's too many people who are wrong, but they're comfortable with this error.
Okay. Thank you. And Dr. Fellis is, Dr. Patrick Fellis is getting our Lifetime Achievement Award for Enterprise, the Florence Nightingale Award at our gala this evening. So thank you. So if we could go through, and if you want to make a statement about research priorities to get to a standard of care for frenulum surgery. I mean, it kind of boggles my mind that it's hit so much on the mommy blogs, and it's increased in interest in the last few years. And, you know, we have so much work to do, it seems. And, you know, we're really blessed to have leaders here, pioneers clinically and with research to address some of these things. So, Dr. Sproit, and then we'll pass it along. And we've got to be sensitive to time, so let's be succinct, please.
So you want to introduce?
I think we've introduced ourselves already, but so just if you have
In terms of, from what I've heard and popped up in my mind, was indeed if the association with breastfeeding and then the whole myofunctional therapy approach, if there is any association that can be shown based on even just questionnaires or in your clinical practice, if you can already filter those that had or did not have breastfeeding, bottle feeding. So make that link. And then the other one, if you want to, in terms of a discipline, my thoughts would rather go, if you really want to aim for kids, it's the developmental outcome, better attention, better performance. That is one thing that is opening doors as well. Okay.
Fantastic. I think maybe especially school performance.
Yeah.
Yeah.
Absolutely. Well, that's actually how sleep disordered breathing came up. Dr. Kozal went to schools, went to the lowest performers in class, offered them a sleep study in his sleep lab, and linked it to the performance of these kids, and showed that those kids actually have an increased risk of sleep disordered breathing, the lower performance. So for you, the same. If you do the treatment, have some pre-treatment and post-treatment links with their performance, scholastic or attention behavioral questionnaires are very easy to do.
Yeah. Thank you. State your name.
Karen Spurt, and I'm now in France, in Lyon.
Katrina. Oh, sorry. Katrina Rogers from.
Perpendicular.
From the UK. In the UK we have the NIHR, the National Institute of Health Research, and part of that is patient public involvement, and I think that it is important to look at this. There are angry parents out there, and I have created a lot of complaints in the National Health Service because I've passed children for assessment for tongue tie, and I think it is very relevant to involve parents and patients as part of that NIHR funding. It's thinking about doing research to inform change to health policy, and I think that's a good way forward.
Thanks. Thank you. And so you know, Katrina is here as a fellow of the Winston Churchill Memorial Trust, and it's a great group. 2,000 people apply for 100 slots, and it's very serious. It's supported by people like Queen Elizabeth and others, and her remit is to explore how to put myofunctional therapy into the NHS, and there'll be resources applied to that as part of this journey.
The Queen.
Queen Elizabeth II.
The second. What I'd like to say is short and sweet. Identification of tethered oral tissues is a big part of myofunctional health and health in general for infants. What I would like to say is that consider optimal timing of release. That identification, thank you, does not mean rushing to get a release. This has to be a comprehensive cranial nerve evaluation and taking multiple complex issues into account that individualizes the care for babies.
Your name and where you're from?
My name is Michelle Emanuel. I'm from Cincinnati, Ohio.
USA.
The nasty.
So Richard Baxter from Alabama. And so one of the interesting things is like this babies, there's like randomized control trials, and there was scissors and a lot of them were clips. They probably weren't full releases, but anyway, for speech, for example, there's like one article from 2002, Messner and Wallachia, Ito from 2015, and then like we put in a small article out last year. There's like literally like 3 articles like on speech and tongue tie. And we have another one coming out soon that had more patients in it, but speech is a huge area where it needs a lot more research. Solid feeding, last year we put the first one out connecting solid feeding and speech. That's all there is. It's one case series on solid feeding and tongue tie. There's literally nothing. For adults, is huge. Like Zagi's just came out. That's like one of the first. Before that, there was maybe one from like Japan from a while ago, from like 90s, 1990s or 2000s, early 2000s. So on the older spectrum, we definitely need some for the babies too. But for the older kids, there's like nothing for solid feeding, sleep. And tongue tie, because it's a huge area that people are just neglecting. They don't even realize that if you get the tongue up, like you said, they sleep better, but often they can't get the tongue up because it's tied down. So if we can get some good research on that, that would be really huge.
Or especially the back of the tongue.
In the back of the tongue, yeah exactly.
All right. Thank you so much. I'm Sarush Zagi from Los Angeles, and I'm medical director of the Breathe Institute, where we're trying to bring higher levels of research and evidence to the field of tongue-tie release surgery. So we've been fortunate, thanks. And Cynthia is one of our research affiliates as well, and I'm about to talk about what we're doing. So we've already published on case reports and case series, as well as retrospective cohort studies, but what the journals really want to push the field forward is prospective studies. And not only prospective, but prospective, multidisciplinary, and multi-center studies. And to that extent, we all have to be using the same language in our intakes and be using the same kind of forms as we apply similar treatments and check out their results. And so what we've been working on the past 2 or 3 years is to kind of come up with different kinds of intakes. And so what we have now is the fairest.org, okay? And that's led by Cynthia Peterson. If you stand up, she's put tremendous big round of applause for her. Rising Star Investigator Award. And she's going to win a Rising Star Investigator Award, which
you got 2 years ago.
Which I got 2 years ago. And so the purpose is that if you guys want to do a research study, there'll be forms on there, like intake forms, that help you look at all the different factors. Because it's not just about patients with tongue tie. You can't just do restless leg syndrome and tongue tie myofunctional therapy, because a lot of other variables too, right? If they have high arch palate, malampati, big tonsils, posture, what's that, TMJ issues, there's a lot of different factors, right? So these intakes that we have will look at all the different variables and tongue tie and myofunctional disorders, and then look at the outcome. That way you can go back and control for, well, a lot of people improved, but some didn't. And that's what we're finding in our studies. So for example, we're doing myofunctional therapy, tongue tie release with pre and post sleep studies. And I'm finding that a third knock it out of the park, a third don't respond, and a third get worse. Their sleep apnea gets worse. Okay? And a lot of times that's because they don't have enough space in their mouth for their tongue. Yeah. But then after they get widened, then they do better than ever before. Okay? And so the only way that we can study these things is by having really good intakes that allow us to go back and compare patients. And so we welcome you. There'll be different versions for different populations. We have a version for the pediatric dental population. We'll have one that integrates the cranial nerves. We have one in adult patients, and we have the one that we're doing out of our Breathe Institute IRB protocols as well. So we invite you to take a look there and to participate in research with us. Yeah.
When are these going to be available?
They're ongoing research. You want to speak? You want
You can look at ferris.org.
Yeah. So we'll always put the latest stuff on that website. Yeah.
FAIR.
You want to mention anything, Cynthia?
Check back in a week. We're adding a bunch more stuff, so there's some basic stuff, but check back.
Yeah. And then look in the brochure for tonight's gala, and there's a little thing on it in there. It's the. It's in there.
In the middle,
In the
toward the
middle.
back.
Here we go.
You can still get tickets.
Oh, that's what Ferris. Okay.
Did you participate in this?
Huh?
Did you participate? No.
Did I participate?
We got to keep going.
Okay, Yu Wing Chu, General Dentist, Singapore. Again, I think coming from a small country, we are very dependent on the international movement. We look to many of the international organizations to establish the norms, the standards, and guide us in the protocols. So all I can say is that we even in big countries, established researchers, I think they're also facing their own roadblocks. I can only say that yes, please push forward for more, organization like FDI, right? I think with them establishing and also at the same time endorsing all this research, this screening, right, and the work like frenectomy, I think then we can actually move forward more, in our country. Thanks.
Thank you. And I may have neglected to mention, but Wang Chu with others have been talking about for years starting a scientific society for Singapore for myofunctional therapy. So I'm really excited that we're going forward with that and honored to help that. And so I think Wang Chu will be the founding president. And we've got very serious people like the president of the Pediatric Medical Society there, Ann Go, who some of us know, my mom and I. And I think, we don't have to wait for the big countries to do something. We know so little, and there's so much you can do because so much of the population at large suffers. And that there could be great studies that come out of great institutions in Singapore, which you have. And we can all learn, hopefully, from work done in Singapore or Bangkok or Beijing or Paris someday. And that can be shared easily across borders with, like Dr. Zaghi said, coming up with consistent tools so we can examine and validate things and know what we need to look at. Because this is, it's precision medicine. It's not old-fashioned kind of like, this is, one thing that was really, I think, significant, I was very excited about, because I had a small role in it, but at our World Sleep Symposium in Vancouver 2 weeks ago, the AMS had a symposium. And one of the presenters there was from the French Orthodontic Society. And they just published a statement on pediatric sleep, and it was signed off on by the European College of Orthodontics, the French ENT Society, and many other societies, the French Sleep Society, French Pulmonary Society, about 12 or 13 total. And one of the significant advances was myofunctional therapy was proposed as a mandatory intervention as a first line of treatment, not as a third line of treatment that you explore after everything else has failed, call up the weirdo tongue people and see what they have to offer, but that there was enough knowledge, enough literature already that this should be a first line of treatment. We got a statement like that from the Italian Minister of Health just a couple of years ago. So we look forward to seeing what we can learn from Singapore and other countries such as yours. Thank you.
So Ito again. My research started from university, Keio University, where I graduated, and it continued. I studied further at the Mass General Hospital in Boston. And after that, I have been engaged in many different kind of researches, but I feel the difficulty of doing a research in tongue tie, lip tie, there's no control. I mean, there are, but just a few, 4 or 5 RCTs, I think there are. And the numbers are small. So statistician may say there's not statistically significant. But I think not significant does not mean no meaning. It has meaning, and ethically we cannot make a control group. So if we could make a control group, and if we could increase the number of patients, it becomes significant. Until that, we need to supplement or by the narrative-based medicine. We need to hear the voice of parents, mothers, and babies. That's my feeling about the research. Okay?
Yeah. 基本的な乳児の行動がまだ分かっていないことがすごく多いです。
Dr. Abe, dentist from Japan. I find that we don't have the basic movement of infants, and there are many things that we don't know yet.
例えば生まれたばかりの赤ちゃんは普通口は開いてるもんです。
For example, the newborn baby, the mouth is open.
でも口は開いてますけど口で息はできないです。
The mouth is open, but they are not breathing from the mouth.
ではいつから口で息ができるようになるのか、口のボリュームが大きくなってからなんですけど、大体それが何ヶ月ぐらいなのか、そういうことがちょっとはっきり分かっていないです。
So when do they start breathing from the mouth? From how many months? We still don't know.
こういった本当に基礎的なところからまず考えて研究していかないといけないんじゃないのかなというふうに思います。
So I feel that we need to research on those basic starting point when we study the myofunctional therapy.
Thank you.
So Dr. Abe is getting 2 awards that are gala tonight. One, like I mentioned, for public health. The second is interdisciplinary for interdisciplinary leadership, Centers of Light Award. And he created preschools in order to figure out how to intervene with children, infants, toddlers, in their myofunctional disorders. So it's incredible, and thank you for your vision and leadership. It's catching fire a little bit, being on the covers of magazines like Parents Magazine in Japan, which might get distributed to 2 million parents or something like that. It's a very exciting time. So thank you very much for your courage and leadership. So I think that's going to wrap it up. I just want to thank everyone for coming and for your time. We have some work to do because we have some people who are winning some awards, and we've got to get busy. We've got to get all changed. So our fourth, he didn't have, our fourth AMS Hippocrates Gala, Venkata Koka, Dr. Venkata Koka is here also. We all got to get ready because we got to learn how to holler and swaller. Is that right? Because we're going down to, where are we going? Oh, this is Inside Out, but it says Redneck Riviera down in Honky Tonk Row, where greats in music have come together. Bob Dylan, Elvis Presley, Johnny Cash, Patsy Cline, Hank Williams. And there's such a beautiful crossover between the artistry of good medicine and good music. They're both collaborative. They're both requiring precision. And they both, in their best forms, I think, require a great heart. And so my hat's off to all of you who make beautiful music in your medicine. So join us at aamsinfo.org. We've got some exciting next steps. Our next planned meetings are in support of the International Pediatric Sleep Association, IPSA in Brisbane, around the 20th to 25th of October 2020. And also we will have a Congress we're looking at, around the same time, one of our sister societies, the World Sleep Society, will have its 16th Congress in Rio de Janeiro, Brazil, September 10th to 15th, 2021. So thank you and good night.